Imagine losing the ability to remember your own daughter's name.
Yeah, that's just a devastating thought.
It really is. Imagine forgetting what city you live in or, what you had for breakfast just an hour ago. But then a song comes on the radio,
Right.
maybe a Beatles track from 1968 or a jazz standard, and suddenly you can perfectly hum every single note. You know the rhythm, you know the melody, and for a few minutes you are entirely present. I mean, how does that happen?
It feels like magic when you witness it. I mean, you see someone who has severely withdrawn from reality suddenly light up, they're tapping their foot, they're making eye contact.
It's beautiful.
But understanding why that happens requires looking past the magic and digging into the biology and the raw data.
Which is exactly our mission today. Welcome to this deep dive. For you, the listener, or for any family watching a loved one experience dementia, that withdrawal is absolutely heartbreaking.
It truly is.
But today, we are looking at the profound, scientifically documented impact of regular music listening on people experiencing cognitive decline. We are not just sharing heartwarming anecdotes here.
No, we need to go beyond the anecdotes.
Exactly. We have a stack of highly credible sources, including a comprehensive scientific review document from Cochrane. They're a trusted, independent UK research organization. And we're also using an accessible summary blog post that breaks down their findings.
Right. It's a great distillation of the science.
We're going to figure out the actual mechanisms here. Like,
Yeah.
how does a simple melody bypass a deteriorating brain? So, okay, let's unpack this.
Well, to really understand the weight of this, we have to differentiate between common sense and clinical evidence. I mean, we all intrinsically know that putting on a favorite song makes us feel good.
Oh, absolutely.
But if a family or a care facility is going to rely on music as an actual intervention for dementia, we need proof that it is a medical reality, not just a pleasant temporary distraction for the patient.
Right. We need the raw, unfiltered data to prove it is actually moving the needle on their quality of life.
And the Cochrane Review provides an incredibly robust set of data for that.
Yeah.
Cochrane has a long, highly respected history of careful, independent scientific work. They do not conduct a single experiment in an isolated, sterile lab and call it a breakthrough.
Yeah, you see that a lot in flashy headlines.
You really do.
Oh.
Instead, they aggregate and analyze existing global research to find the absolute truth. So for this specific review, researchers analyzed 30 different studies involving a total of 1,720 people living with dementia.
Wow. Getting 1,720 participants in dementia research is a massive undertaking.
Oh, it's huge.
Just coordinating the informed consent and the longitudinal tracking for a population experiencing severe cognitive decline, I mean, that is a monumental logistical challenge.
It is incredibly difficult.
Yeah.
And what makes this specific analysis so powerful is the diversity of the settings. These 30 studies spanned 15 different countries.
Wait, 15? That's a lot of ground to cover.
Yeah, we are looking at data from Japan, Brazil, the U.S., parts of Europe, meaning the results aren't just a cultural fluke based on one specific society's relationship with music.
Right, it's universal.
Exactly. Furthermore, the studies took place in real-world care settings. The researchers observed patients in nursing homes, residential care facilities, hospitals, and ambulatory care.
So it basically functions like a giant, highly sophisticated filter. When you look at the methodology in our sources, the researchers didn't just casually Google music and dementia.
No, not at all.
They pulled from major global databases. We're talking Medline, Embase, PsycInfo, CNIHL, and clinicaltrials.gov. They take all those thousands of pages of global data, filter out the poorly conducted studies or the statistical noise, and distill it down to give families a pure, factual drop of truth.
And what's fascinating here is the meticulous editorial process required to create that single drop of truth. The researchers had to prove their methodology at every single step.
I can imagine.
The final findings required sign-off by a lead editor, Dr. Sasha Kupke, at the Institute of Nursing Science at the University of Cologne in Germany, along with an entire team of peer reviewers and policy checkers.
So they're not messing around.
Not even a little bit. They scrutinized the design of every single study included. They are aggressively looking for flaws to ensure that the final conclusion isn't just wishful thinking.
But, knowing the massive scale of that global research naturally introduces a pretty glaring logistical puzzle.
Oh, the measurement problem.
Yes, exactly. If you are studying 400 and 720 individuals who are progressively losing their ability to speak or communicate, how on earth do you measure highly subjective emotional states?
It's tricky.
I mean, You can't exactly hand someone in the later stages of dementia a clipboard and ask them to rate their quality of life on a scale of 1 to 10.
You cannot rely on self-reporting. That is the fundamental challenge of dementia research. Instead, scientists use highly structured, standardized observational tools.
Observational tools, so they're just watching them.
Yes, but in a very specific clinical way. The sources mention several clinical measures, but instead of getting bogged down in the acronyms, it's much more useful to understand how they actually work.
Okay, give me an example.
To measure anxiety, they use the RAID scale, looking at a 2-week time frame. They do not ask the patient how anxious they feel. They observe the patient's behavior. They are looking for physical indicators of distress,
Like what kind of indicators?
like pacing, wringing hands, visible muscle tension, or specific vocalizations. And for quality of life, they tracked overall and subscale scores of the DQL. Depression was monitored using the GDS.
So they are quantifying physical behaviors that directly correlate with internal emotional states. If the pacing stops, the anxiety score goes down.
Precisely. They use similar observational frameworks to track depression and overall quality of life. They monitor whether the patient is eating, sleeping regularly, or engaging with their environment.
That makes sense.
But to make sure those behavioral changes are actually caused by the music, the researchers had to be incredibly ruthless about who was allowed into the data pool. They instituted strict exclusion criteria to ensure the data was completely clean.
Okay, let's play a deduction game here. If the intervention being tested is music therapy, the most obvious exclusion would be someone who cannot physically hear the music.
That was the first exclusion, yeah. They removed any patients with uncorrected hearing impairment or auditory deficits that were so severe that standard hearing aids couldn't fix them.
Right.
If the biological hardware to process sound isn't working, the data becomes useless. But they also went much deeper than that. They excluded anyone who has suffered a recent acute medical event.
Meaning things like a heart attack or, I don't know, a broken hip from a fall.
Yes, myocardial infarction, a fracture, things like that, or a major acute infection. Though, interestingly, the researchers specifically noted that standard urinary tract infections were not an automatic exclusion.
Oh, really? Why is that?
Likely because they are so incredibly common in this population. The logic for excluding acute trauma is simple, though. If a patient just broke a bone, their mood, their sleep, and their pacing are going to be severely impacted by acute physical pain.
Right, you want to isolate the effect of the dementia and the music.
Exactly. You
Yeah.
cannot have the pain of a fractured hip skewing the depression scale.
They also had to account for consent, right? Our sources mentioned excluding participants if there was no substitute decision maker available to indicate the patient's music preference, assuming the patient was unable to answer for themselves.
That is a critical ethical and practical boundary. If you don't know what kind of music the person actually liked before their cognitive decline, you might end up playing heavy metal for someone who spent their life listening to classical piano.
Yeah, that wouldn't soothe them. That would probably terrify them, which ruins the intervention.
Exactly. It would cause severe agitation.
I do want to push back on the core premise here on behalf of the listener, though. Even with all these clever observational tools and strict exclusions, if someone's brain is physically deteriorating from dementia, how do we know the music isn't just a temporary distraction?
What do you mean?
Well, you play a jazz song, they stop pacing and smile for 3 minutes, the song ends, and they go right back to being distressed. How does a 3-minute song translate to a sustained shift in their baseline emotional well-being?
That is the most important distinction the Cochrane review makes. The researchers weren't just tracking momentary smiles while the music was playing.
Oh.
They were tracking longer-term emotional problems, what clinicians call negative affect, over weeks and months. They constantly compared the active music groups against control groups who were receiving usual care or participating in other non-musical activities.
And what did they find?
They found that the music wasn't just distracting the brain, it was actively accessing a completely different part of it to create sustained behavioral shifts.
Which brings us to the actual neuroscience of why this works. The reason a patient can forget their daughter's name but remember a Beatles song is because of where those different types of memories are stored in the brain.
Yeah, the physical anatomy of the brain plays a huge role here.
Episodic memory, the timeline of your life, names, recent events, that is largely processed in the hippocampus. And in many forms of dementia, especially Alzheimer's, the hippocampus is one of the very first areas of the brain to deteriorate.
The physical tissue literally degrades. It's tragic.
But musical memory, especially the emotional attachment to music we loved in our youth, is heavily reliant on the medial prefrontal cortex.
Right?
And this area of the brain often remains remarkably intact much later into the progression of the disease. So when you hit play on that familiar song, you are bypassing the broken hippocampus entirely and activating a perfectly healthy neural network.
It's like finding an unblocked back door into their consciousness.
Wow, that's a great way to describe it.
When you activate that intact network, you aren't just triggering a memory. You are flooding the brain with dopamine and lowering cortisol, the stress hormone.
Yeah.
And the effects of that chemical shift linger long after the song stops.
Which is exactly what the data from those 1,720 participants showed, right? Sustained behavioral shifts.
Yes.
Here's where it gets really interesting. When we look at the tangible results of that neurochemical shift, the Cochrane review is incredibly definitive. People who took part in regular music sessions showed consistently better moods than those who only received usual care.
The review explicitly states that music-based interventions probably improve depressive symptoms.
And the defining variable in that success was consistency. The researchers noted that this tangible shift in depressive symptoms, the kind that registers on those strict observational scales we discussed, became visible after a very specific amount of time.
Yes, after at least 5 sessions.
5 sessions. I love that detail because it gives families a realistic, tangible timeline. It's similar to a physical workout, but for the brain's emotional centers.
That is a perfect analogy.
Like, if you go to the gym once, you don't walk out with a completely transformed body. You might even feel a little confused by all the equipment. If you play a song for a loved one on day 1, you might not see a dramatic emotional transformation. They might just listen passively.
But by continuously engaging with that intact medial prefrontal cortex, hitting that 5-session mark, you are essentially building up a muscle of emotional steadiness.
Exactly. You are regularly lowering their cortisol, which helps them navigate the confusion of their daily routines with far less distress.
The clinical observations deeply support that workout analogy. Across the 30 studies, patients in the music groups exhibited fewer overall problematic behaviors. They were fundamentally calmer and more settled in their environment.
Which is a huge relief for caregivers, I'm sure.
Oh, absolutely. And if we connect this to the bigger picture, there was another standout finding that fundamentally changes the daily reality of dementia care. When compared with other structured activities, music specifically helped people exhibit more social behavior.
What does that actually look like in a real-world nursing home?
It looks like engagement. Patients who typically sat in silence, staring at the floor, began making sustained eye contact with caregivers. They might reach out and touch a family member's hand.
Oh, wow, that's incredible.
They hummed along or even tried to sing words. They interacted more with the people around them.
Yeah.
For someone trapped in the isolation of severe cognitive decline, unlocking that level of social engagement is deeply, intrinsically tied to maintaining their humanity and their overall quality of life.
Okay, so 5 sessions to see a clinical change makes sense in a structured study. But if I am at home caring for my mother, I don't have a team of German researchers measuring her eye contact on a clinical scale.
Right, of course not.
How does a normal family actually implement this? So what does this all mean for you, the listener, outside of a controlled medical environment?
The most profound takeaway from these sources is the absolute accessibility of the intervention. You do not need specialized medical equipment or a licensed music therapist to start seeing benefits.
Though structured therapy is wonderful if you can get it.
Of course, it is fantastic.
Yeah.
But the research highlights that simple, daily listening for just 10 to 15 minutes makes a meaningful, measurable difference.
The only strict requirement is the selection of the music itself. It has to be familiar, right?
Yes, it has to be music the person had a positive emotional connection to before their memory began to fail. That is the key to unlocking that intact part of the brain.
So putting on their favorite jazz album or classical piece in the morning during breakfast, or in the evening when dementia patients often experience sundowning and increased agitation, can easily become a grounding routine.
Exactly. And crucially, amidst all this rigorous global tracking, the researchers found no serious side effects.
Which cannot be overstated when we talk about dementia care. So often when a patient exhibits severe agitation or problematic behaviors, the medical fallback is prescribing antipsychotic medications or heavy sedatives.
Medications that carry massive risks, extreme drowsiness, an increased risk of severe falls, and further cognitive blunting.
Yeah, the side effects can be worse than the symptoms sometimes.
Truly, music is a highly safe, completely gentle, and natural option to support mood and reduce agitation without introducing a single chemical side effect.
But we do need to manage expectations for anyone listening who wants to try this tomorrow. The sources are careful to explicitly state that music is not a cure for dementia. It does not stop the underlying disease.
No, it doesn't.
So how should a family frame their hopes when they start this 10 to 15-minute daily routine? What is the realistic goal?
The realistic goal is connection. Because dementia progressively destroys the parts of the brain responsible for language and logical processing, words eventually fail. Trying to communicate through conversation becomes incredibly frustrating for both the patient and the family.
It's like you're speaking two entirely different languages.
Exactly. But because the brain's ability to process and enjoy familiar melodies remains largely untouched, music serves as a unique alternative bridge to reach them. Families should frame their hopes around creating little moments of light.
I really love that. Moments of light.
The goal isn't to bring their memory back. The goal is a few minutes of shared joy. A smile, a recognizable tap of the foot, a moment of feeling truly safe and emotionally steady when all other forms of connection feel completely out of reach.
It is about changing the quality of the time you have left with them. Let's summarize the core takeaways from the deep dive today. We are looking at massive, rigorous data.
Very rigorous.
The Cochrane review took 30 independent studies encompassing 1,720 people across 15 different countries and proved that regular music listening safely reduces depression, lessens behavioral problems, and significantly increases social interaction for people with dementia.
By bypassing the damaged hippocampus and engaging the emotional centers of the brain.
And the magic threshold seems to be around 5 or more sessions to really start seeing those sustained daily emotional benefits.
Yeah, consistency is everything here.
So to you listening, this isn't just dry clinical data meant to sit in a medical journal. It is a highly accessible, totally free tool. If you have a loved one facing dementia, just 10 to 15 minutes of a favorite song is a comforting, side effect-free routine that you can start right now.
It doesn't require a doctor's prescription, a pharmacy visit, or expensive equipment.
It just requires a play button.
This raises an important question, though.
Oh.
If a simple, familiar melody from 50 years ago can completely bypass the severe physical destruction of dementia to instantly unlock social behavior, lower stress, and bring someone back to the present moment, well, what does that tell us about how deeply rhythm and music are hardwired into our fundamental sense of self and our shared humanity?
Wow. It makes you wonder what else is locked away, just waiting for the right key. Thank you for taking this deep dive with us. Take care, and we'll see you next time.